The solution to our healthcare crisis, could it be workplace wellness plans? Now, I want to let you know from the start that we have a crisis. So any of you pay for your health insurance? A lot of you do. What's happened to the premiums? Over 200% increase in the last 15 years, and there's no slowing down. We actually spend more on healthcare than any other country in the world by far, $2.7 trillion per year. So you would expect us to have the best health of any country in the world, right? Well, no. We rank number 43 in the world. We are below undeveloped countries. And our life expectancy is decreasing. Now, as I was going through school and practicing, life expectancy kept going up and up and up. In 2014, it started going the other way. And I sounded the alarm then. I said, we have a problem. We need to be doing something. These healthcare problems are largely preventable and often reversible, and they have a huge impact on our budget and health. If you look at one problem, diabetes. Now, I will tell you, today in America, half of all Americans are either diabetic or pre-diabetic. And what does that do to healthcare cost? A person with diabetes costs about $10,000 more per year than someone without that condition. So this is a crisis. The population is not healthy. In fact, the United States loses $227 billion in productivity each year because of our poor health. And they say, this is not sustainable, and it's not sustainable. So let's talk about workplace wellness programs. And there are three things that I want you to know. Number one, they save companies money. How much money? Significant money. And I'm going to show you some studies, but $3.27 is not out of line for your return on investment. So what do I mean by return on investment? It means the investor saves $3 for every $1 spent. Now, if you just break even with this, a 1-to-1, it would be good, but when you're getting $3 back for every one you spend, it's phenomenal. And lots of companies do this. Johnson & Johnson, $1.88 to $3.92 return for every dollar they spent. Citibank did even better. Return on investment was $4.56 to $4.73 for every dollar they spent. And a large manufacturing plant kind of set the bar high. They had a $34 savings for every dollar they invested over a 10-year period. So if you look at all the studies out there, a lot of them come in at $3.48, you say, by investing a dollar in a wellness plan. A recent study of 25 different wellness plans showed a $5.81 return on investment. So that is saving you money on healthcare cost. But there's additional indirect benefits. Absenteeism goes down. Work comp claims go down. Short-term and long-term disability claims go down. A study from Harvard showed that medical costs fall $3.27, but in addition to that, absenteeism costs fall $2.73. You combine those, it's a $6 saving for every dollar they invested. The second thing I want you to know about wellness programs is some of them don't work. And there are articles that are popping up like this all the time, showing that there may not be an effectiveness in them. So why is that? After this large warehouse company instituted a wellness plan, they found no significant difference in clinical measures of healthcare spending and utilization, and employment outcomes after 18 months. So that's terrible. Spend the money and there's absolutely no change. Why do some of them work and others not? Here's the reason. If you look at these programs, only 1/3 of the programs offered include nutritional counseling. 2/3 of these wellness plans don't even get into nutrition counseling. Now, if I was going to ask you, what is the most powerful tool you can use to change someone's health? Nutrition counseling. Here's one that didn't work. It was PepsiCo's wellness plan. So if Pepsi instructs their workers on getting healthy, do you think they say, don't eat the products we make? Probably not. They probably focus on other things which are less effective. And why do they mostly fail? No diet changes. So here's a review of what these plans included. And most of them got people moving more, a little more exercise, which is helpful. But if you look at the nutrition part of it, there was no change in the number of meals eaten out. There was no change in the number of soft drinks they consumed. There was no change in the people reading labels and looking at nutrition facts. There was no change in getting them to eat more fruits and vegetables, no change in getting them to eat more whole grains and cut down the bad fats. They had failed in every one of those categories. In fact, if you look at the average improvement in some of these plans in their intake of fruits and vegetables, it was 0.7 portions per day. All right. They got them to eat an extra half a cup of peas a day. That's what we're talking about. Nothing significant. Third thing I want to tell you about wellness plans is the 7 Systems plan is highly effective because it brings lifestyle into the equation. An impressive number of studies have shown that lifestyle is the root of what ails us, particularly for chronic conditions. The study also showed that changing one's lifestyle can have a dramatic effect on health improvements in both prevention and treatment of disease. Now, for those of you who are not familiar with the 7 Systems plan, your body has 7 main systems. These systems determine everything. And if they're working correctly, you're going to have great health like I do. But most workers will have one or more systems that are not working correctly, which can cause their weight to go up, their blood pressure to go up, cholesterol to go up, and on and on. The 7 Systems plan helps address each of these problems. Here's Christy. She lost 50 pounds in 6 months on the 7 Systems plan. And interestingly, in this picture, she told me, I could not run 1 mile. The day she took that picture, she actually had ran 8 miles. Now, do you think she's a more productive worker? Absolutely. Dan had diabetes and obesity. In a few short months, they were both gone. Denny had high blood pressure that he had been on for many, many years. In 6 months, he had lost over 50 pounds. His blood pressure was perfect without blood pressure medications. And Kurt. Now, I remember Kurt started the 7 Systems plan because of severe migraines. He was missing so much work, he said, I'm afraid I'm going to get fired. And he was going to. In 3 months, these migraines he had had for several years were gone, and they've been gone for the last 5 years now. A much better worker now because of fixing his system. Alice had 600% more energy after going through the 7 Systems plan. Do you think that makes an employee more productive? And Jody was a school teacher. She told me that she used to go home to grade papers, and sitting there, she would frequently doze off. After losing 65 pounds in 6 months on the 7 Systems plan, she started taking up kickboxing classes after work. A much better school teacher because of fixing her systems. And last, this is Larry, lost 50 pounds, got off all 10 of his medications. I love to help people get so they don't need these medications. So the 7 Systems Plan is one of the only plans out there that improves employees' health by getting each of these 7 systems working correctly. I want to mention a few keys to why the 7 Systems Plan is so effective. Number one, it is clinically proven on thousands of people. Blood sugar, blood pressure, cholesterol, you name the factor you look at, everything improves. There's objective testing that we do, so we don't have to guess if things are improving. We actually see the improvement. Education is a huge part of the 7 Systems Plan. They're going to learn about reading labels. They're going to learn about food groups. They're going to learn about simple ways to eat healthy food. Accountability is provided to help these people reach their goals. A few key supplements can be very helpful. We also introduce them to fasting mimic diets, which is restricting the number of times you eat in a day and the number of hours you eat in a day. And the last thing we do is find what works for them. Everybody's a little different, so we find what works for each person to get them to their health goals. So I want you to imagine what your employees would be like at their ideal weight for good, cholesterol, blood pressure, and heart healthy, 600% more energy, hormones optimized, immune system protecting them, and not needing medications. If you want to see the best wellness plan out there, I want you to check out the 7 Systems Plan. Now, it is available in provider offices in many states now. It's also available in my office, and we do live stream our meetings across the nation, and it's also available as an online course. Thank you for joining me.